will discuss the acute chest syndrome in sickle cell disease crisis. So basically, the acute chest syndrome usually occur in the third trimester and the postpartum. That is the first 7 days. That is the very important part of your postpartum care in sickle cell disease patients. So basically, the 87% death in sickle cell anemia in pregnancy due to acute chest syndromes. Presentation, they will present like fever, chest pain, dyspnea, cough and low saturations. And chest x-ray, always you have to go for a chest x-ray. There will be a new long infiltrate you will get. Onset, it will be most episodes are followed by acute pain episodes within 24 to 72 hours. The diagnostic criteria to get a diagnosis of acute chest syndrome is defined by new pulmonary. Very important. This new has to be there. There will be new pulmonary density on chest imaging involving at least one complete lung segment and at least one of the following. So very important. The key words have to remember. They will be the diagnostic criteria. There will be a new pulmonary. You can see there will be a new pulmonary density and at least has to be involved at least one complete lung segment and at least one of the following, like temperature. There will be a fever that is more than 38.5 degrees centigrade, or there will be a more than 3% decrease in SP saturation, oxygen saturation from a documented steady state value on room air. There will be a tachypnea per age adjusted normal value, intercostal retraction, nasal flaring or use of accessory muscle for respirations, chest pain, cough, wheezings and rales. These are along with any one of the followings, plus new pulmonary density on chest imaging involve at least one complete long segment plus any of the followings. Okay, any very important is at least one complete long segment. There will be a new pulmonary density on chest imaging has to be there. Then along with there will be fever, saturation fall, tachypnea, chest pain, intercostal retraction, nasal flaring, cough, wheezing, rales. Okay, so how we manage the acute chest syndrome could lead to acute multi-organ failure like dysfunction of two organs like lungs, livers or kidney. The risk factors very important. The smoking is the most common reactor, reactive airway like hypersensitive reaction, asthma, no vaccinations, not on hydroxyurea in pregnancy because they have stopped hydroxyurea. That will increase risk of sickle cell anemia as compared to baseline. So basically our treatment plan based on the oxygen support, that is saturation has to be more than 96%, NIV mode or mechanical ventilation depending on the need of the patients, bronchodilator in patient with asthma or reactive airway you have to give bronchodilator, antibiotic cephalosporin with atypical coverage like azithromycin you will give. For ill patient, gram positive coverage with vancomycin can be started. So very important, the dose of antibiotic, the cephalosporin or azithromycin or vancomycin. Blood transfusion very important. Simple or excellent transfusion has to be given. To decrease the HBS percentage, you have to give exchange transfusions are generally indicated for every individual hospital with acute chest syndrome. What are the indications for exchange transfusion in acute coronary syndrome? The previous history. If they have a previous stage of severe acute coronary acute chest syndrome and rapidly progressive ACS, that will call multi-organ failure. Progression of ACS despite simple transfusion. After a simple transfusion, if it is progressed to acute chest syndrome, then you go for an exchange transfusion. Severe hypoxemia, that is saturation is 85%, then PaO2 is less than 55 ml, then you go for exchange transfusions. Should be done manual exchange transfusion or automated. 70 ml per kg body weight, total body volume, approx 20 body has to be given. Could be repeated 24 to 48 hours if no response has been occurs. So basically, what are the risk factors of complications? Vaso-occlusive crisis, microalbuminuria, urine tract infection, transfusion difficulty, history of obstetric problems, social difficulty. The pregnancy complication, the rate of complication, the rate is the vaso-occlusive crisis and acute chest syndrome is 20 to 50%. Cesarean section is 2 times more compared to the normal patient. Infection is 24% increase. Preeclampsia is 30%, and preterm delivery is 90 to 45%. Fetal growth risk is 80 to 20%. Okay, so basically these are the acute chest syndromes. Thank you. If you like this content, please subscribe my channel. Thank you all. Good night.